So are you all able to see my screen?
Yes.
Yes.
Are you just seeing the screen, or are you seeing? Because
We're
I just
seeing
shared
your
the-
notes as well. So if you want to go
Okay,
to a
so
presenter
I
mode.
will just go to presenter notes, maybe.
Yes.
Okay, there we go. I think now you should be able to see just the screen.
No, you're still, okay, now, yes, we are.
Yes, okay.
Very good.
Let me just come back here. So, Bismillah ar-Rahman ar-Rahim, Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. I will start. So, thank you all. Najib asked me to talk about judicious use of antibiotics, but I'm going to change it a little bit because, since this is from an Islamic perspective, I thought it'd be better for us to discuss some of the philosophical aspects as well. Because, if I make it a plainly medical topic, then it doesn't give us this aspect of discussing it from the Islamic perspective. So I changed it. So Najib, I apologize if this is slightly different, but this is the rise and fall of antibiotics, scientific discovery, and the tendency of science to overreach its achievements. And I think we'll go over some thoughts that I've had over the years that I have been involved with infectious diseases, the prescription of antibiotics, and the value of antibiotics from a physician's perspective. So I'll make an open discussion if people want to jump in and ask questions in between. Please feel free to. So am I coming through loud and clear?
Yes, please.
So all that I could summarize the entire lecture and saying that antibiotics are precious drugs. Please use them according to your physician's instructions. So this is William Osler, who was one of the 4 founding members of Johns Hopkins University. And he said the desire to ingest medicine is one of the principal features that separates man from animals. So we have this natural tendency of sometimes, taking medicine for our ailments, true or imagined. So I think this is a very wise quote from Osler, is that the tendency generally in the West has been to rely too much on prescription medicine, sometimes for even ailments that otherwise would go away on their own. And I think infections are primarily a very typical example of this. But anyway, you all know that antibiotics were discovered by this man, Alexander Fleming, who during his Nobel laureate lecture in December 1945 made a very, very prophetic statement. He said the time may come when penicillin can be bought by anyone in the shops. Then there is the danger that the ignorant man will easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant. I mean, I think this was a very remarkable statement to be made in 1945, just when penicillin was introduced. He had predicted, as is very obvious now, and if you want, I can share some data with you regarding the fact that most of the antibiotics that we have discovered are actually being lost by the abuse of these drugs. Now, this is Alexander Fleming visiting Najib and my alma mater in Karachi. He's right here in the center. I don't know if my cursor is there, but this is Alexander Fleming. And there's a fantastic discovery story about Alexander Fleming and penicillin, and that also involves serendipity. I think Allah subhanahu wa ta'ala sometimes creates coincidences in man's life that directs him towards great discoveries. And there is a divine ordinance at play sometimes that we don't give appropriate credit to. And maybe, one of these sessions I can go through those stories regarding the discovery of penicillin. But
So this was in Dow Medical College?
This is Dow, yes. This is Dow.
Wow.
I believe the year is after his Nobel laureate lecture. This is, I think, 1948 or something like that, just after the creation of the institution.
Oh, wow.
Yep. So who knows who this man is? So this is the man for whom Angela Merkel, the chancellor in Germany, actually stood up during the G7 meeting and came to meet him instead of him going to meet her. His name is Yuval Noah Harari. Does anybody know about him? So he is a historian, professor in history from Israel, actually, and his claim to fame is a very famous book that he wrote a few years ago called Homo Sapiens, that describes sort of the evolution of human culture and all of that. And so he's a historian, but he relies totally on the scientific method. So one of his other books is called Homo Deus. And this is what I think is typical of a mentality that is so arrogant that it extends or extrapolates human achievement to a point where the meaning of the word Homo Deus is man as God. So according to this world famous historian, he feels, based on purely scientific reason, that we are not going to be dependent, or even this concept of religion and dependency on a higher being is all ludicrous, and that man himself will be able to determine his own destiny to the point where he is able to extend his own life and all of these kind of things that bear out of it. So these are a few quotes from the book. It says, if science is right and our happiness is determined by our biochemical system, then the only way to ensure lasting contentment is by rigging this system. And humans, as we have known them through history, will disappear. Our species will be upgraded into gods through the efforts of biological engineering, cyborg engineering, or engineering of non-organic beings. So you can imagine sort of a almost overreach of the arrogance of achievement in science that this book describes. And it's a very famous book. You can Google it. It is on the New York Times bestseller list as, the work of a great thinker. So I leave it open. I mean, I'm not making any judgment calls. Allah subhanahu wa ta'ala knows best, of course. But I was just going to put this forward sort of as a example of what I'm going to be talking about. So a similar point of arrogance was made by this very famous US Surgeon General, who's the 10th Surgeon General from 1965 to 69. And he made the statement about antibiotics. He says the time has come to close the book on infectious diseases. We have basically wiped out infection in the United States. Famous last words. We know that infection is not only just prevalent today, but even more lethal. You have seen the COVID epidemic, and you've seen many other epidemics come along the way. People die of resistant infections every day, but this tendency of human beings to discover one thing and all of a sudden think that they are in control of their surroundings and nature and other things is very prevalent throughout history. So, what I would like to allude to is, this is from Surah Al-Baqarah, from the second chapter in the Quran, where in verse 19 and 20, basically, I've used Muhammad Asad's translation here and a little commentary by Muhammad Asad, which I think is very pertinent. So this is the parable that Allah subhanahu wa ta'ala is describing about people are like, those people who are arrogant are like, when there's a lightning strike, they get a little bit of light, they walk a little, and then God takes away their vision and there's complete darkness. So what Muhammad Asad says on the left on the screen, you can see he's giving an explanation. He says, in the parable of the people who kindle a fire, we have, I believe, an allusion to some people's exclusive reliance on what is termed the scientific approach as a means to illuminate and explain all the imponderables of life and faith, and the resulting arrogant refusal to admit that anything could be beyond the reach of man's intellect. This overweening arrogance, as the Quran terms it, unavoidably exposes its devotees and the society dominated by them to the lightning of delusion, which well-nigh takes away their sight. That is, still further weakens their moral perception and deepening their terror of death. So what the ayah means that sometimes we make one simple step in science, but then we extrapolate it to the point that we think that we've solved all the mysteries of life. And infectious diseases and the use of antibiotics is a classic example of where this has gone wrong. So the philosophical question about the scientific method is, does this over-exuberant hubris and arrogance make any sense from the infectious disease standpoint? So this is one of our Islamic heroes, Ibn al-Haytham. And Ibn al-Haytham was a polymath, a great philosopher and scientist, and he is the one who studied optics in great detail. And some of the very famous texts of optics actually come from him, the modern concepts of optics. And he is the one who actually laid down the foundation of the scientific method. So that scientific method primarily means that we use our 5 senses, and we use them in such a way that our experimentation is unbiased. And anyone in medicine today will tell you that, typically when you do an experiment, you put a control arm and you put an interventional arm, and then you compare your intervention, making sure that all the other variables are evenly distributed between the 2 arms. That is, the only change is the variable that you want to test with your intervention. All the rest of the variables should be evenly distributed between the 2 groups. So, I'm sure all of you here are familiar with this method. And then you use your faculties. So this is, I'm not here to debunk science. Of course, I'm a scientist myself and I'm a physician. And, we use this, and so I'm not here to discount methodology. However, Ibn al-Haytham pointed out there is a basic flaw in this method, and that is the absence of evidence is not necessarily evidence of absence. So your conclusions and how you extrapolate your conclusions should be very measured, because I'll give you a typical example. It's a very simple example. We in medical school, we learned that one of the most important aspects of digestion of food and nutrition is mastication. It's how you chew your food. Now, I would challenge you to go to any nutritionist today who gives you a lecture, not just about what you're eating, but that you should chew properly and that you should spend a lot of time, this is the importance of chewing, etc. But this is almost uniquely absent from the advice given by nutritionists. The reason is that it is very difficult to conduct an experiment to measure chewing. Because we cannot actually measure mastication, it is randomized between the arms and not taken as a variable to which we can intervene. But the absence of that evidence does not mean that chewing is not important. So the absence of evidence is not the evidence of absence, which is something that often people forget when they're studying science or looking at scientific proof. So having said that, anybody, this is from JAMA, which is the Journal of American Medical Association. This is the decline in the mortality associated with infectious diseases over the 20th century in the United States. These arrows mark important milestones in the reduction of death from infectious diseases. Can anybody tell me on this graph of decline in deaths from almost 1,000 per 100,000 of population down to almost 50? Does anybody know where antibiotics came in?
Somewhere around 1940s.
So you would say about here, right?
Correct.
You wouldn't be very far off, because actually, this is where the first use of penicillin occurred. After 80% of infectious disease mortality had already been taken care of. How many people actually recognize that today? Most people think that infectious disease mortality came down because of the discovery of antibiotics. In fact, there are epidemiologists today who argue that antibiotics have had no impact, absolutely, in the reduction of mortality from infectious disease. In fact, if you look at the graph, after 1980, it's going up. And people would argue that this uptick in the infection mortality may be related to the use of antibiotics. Isn't that surprising? So actually, it is just clean water, basically, that has brought down, as soon as the health departments were formed, sewage was separated from clean drinking water and chlorinated water supply came into the circulation. That's when you've had a decline. Vaccines are a big part of the decline after the introduction of penicillin. Most people think that the residual decline was because of the implementation of vaccination, and then you can argue about antibiotics, whether they have been useful or not. But the concept, even to the layperson today, is that, oh my goodness, my throat is sore, or no. By all means, antibiotics have a very important role to play in a certain subset of the population who's hospitalized or got infections, etc. And in certain diseases, yes. But primarily the role has been exaggerated just because it was an intervention of human endeavor. So remember this theme: whenever this intervention is of human endeavor, it's surprising. We give more credit to ourselves than is necessary, and we kind of, blow it out of proportion. And I think that's what I wanted to discuss. So I'm going to just bring things back into perspective by giving you some data that you probably have not looked at before. And I think it's something very basic. Whenever you tackle a topic, go down to the basics. So what this represents is the balance between, if you took every other living creature on the planet, you took human beings, animals, trees, plants, fishes, birds, everything, and you put them on one end of the scale and you put bacteria on the other, bacteria would outweigh, not outnumber, outweigh the entire non-bacterial biomass of the planet many times over. And in terms of numbers, so this is biomass. So, the human biomass compared to the bacterial biomass is less than 0.0001% or something like that. So if you take 10,000 tons of biomass, to give you a scale, this red portion is 1% and this white portion is, a fraction of 1%. And that would represent the human biomass. So to think that our antibiotics, as the Surgeon General said, will close the chapter on infectious diseases is, I think, sort of naive to think that you would somehow, if any one of these bacteria are perturbed, as you can see, sometimes you have outbreaks of severe disease. It is foolish to imagine that your human endeavor would be sufficient to control that epidemic. The balance, mashallah, is created, God has created such a balance that we live in harmony with all of these microbes. And not only do we live in harmony, the amazing thing is that and this is something that, these bacteria they have characters just like human beings. Every niche in your body, your nails, your mouth, your gut, your armpits, the mother's uterus has its own specific bacteria that reside there. And these are called the commensal flora. They're so accurate that now we've begun mapping these bacteria, and you can actually tell which part of the body these bacteria are from by mapping the genotype of these bacteria to those locales where they live. This is a mind-boggling complexity. And now we know that disturbance or permutations in the flora of these specific sites are often reflective of disease. So your bacteria that live within you know that you're going to get sick before you even get sick. And I remember about 20 years ago, there was an infectious disease society meeting here in the US. And for the first time I heard by the keynote speaker there, his name escapes me, he's from the University of California in San Francisco. Anyway, it'll come back to me. But you can type a child inherits bacteria from the mother. And up to 1 year of age, if that baby is breastfed, you can identify the baby as good as a fingerprint to the mother by just taking a stool sample and matching it with the mother's stool sample. So these are complexities that we often, sort of put at the wayside because we sometimes ridiculously simplify biology to the point that we want our discovery to overwhelm, the evidence out there. So we inherit these bacteria that are specific to us. So Najib will be inheriting his mother's bacteria, I will be inheriting mine, and so on and so forth. Each family then has a group of bacteria that they share amongst themselves. So these are so important to us that they form one of the largest organs in the body. Any biologist today will tell you that the bacteria that reside within the human body are like an organ for us. It's just like the liver or the heart. So they actually contribute more towards our genetic makeup than has previously been appreciated. So whether you're happy, whether you're sad, there is a bacterial neural axis, there is a bacterial immunological axis, These bacteria teach us how to defend disease against other predators. These bacteria actually fend off other dangerous bacteria from the body. So if you take antibiotics, you're actually disturbing an entire system that has been created by God in order to protect you from a number of insults. Just by number, the bacteria living within us outnumber us by 1 to 10. So if it was a democracy, we would lose. So it's basically 10 to 1. Now, this is what I was telling you. If you are born by cesarean section, you can easily type your bacteria, and it shows that babies who have been born by cesarean section have, these blue dots represent the bacterial diversity in those babies versus the pink and the red dots that are born through vaginal birth. So much so that you can now track these babies forward. These babies who are born through vaginal section have a higher tendency to develop obesity and diabetes later on in life. And this has got to do with their metabolic makeup. This is a separate discussion that we can go into. Similarly, for breast milk. Now, breast milk contains literally hundreds of commensal bacteria. They're not contaminants, as was suggested previously, but they're part of an essential ingredient in breast milk that helps the child develop its immune system. So I thought that was kind of interesting. But these bacteria that reside within us, they help regulate our appetite. They facilitate energy extraction from food. They help actually form the human membranes after birth and help mature the mucosal surfaces, which are the lining of your gut and your mouth. They're actually essentially in educating our immune system, our ability to fight disease. And I'll go into a little bit more detail. And if you want more information, I can go into that. But one of the bacteria that is essential in educating our immune system is the one that humans have been targeting now because of, again, our naive approach. Once we discovered the fact that Helicobacter pylori is a disease, is a bacterium that causes acidity in the stomach and causes peptic ulcer disease. So everybody's out to eradicate it. Well, Helicobacter is a commensal that occurs in all mammals. All mammalian species on the planet have this bacteria in their stomach. So you should ask the question as to why is this bacterium residing in the stomach? It must have a function. So just to blatantly eradicate it is to cause repercussions down the road. And some of these are now becoming apparent today, so much so that one of the discoverers and Professor Martin Blazer out of New York University is now actually feeding Helicobacter back to humans in order to reestablish that balance. So, they're involved in vitamin production, promotion of hemostasis, and they're also acting as growth factors. So how tall you are or how short you are determined by the bacteria that reside within your gut. Now, I just mentioned Helicobacter. This is the body receiving, this is the gastric mucosa that receives Helicobacter almost as on a pedestal. This is how well this bacterium is connected to the human body. It is recognized as self. The tyrosine kinase, which is one of the enzymes within the bacterial cell, is recognized as self by human beings. So the physicians amongst you here, would recognize that there is no such thing as invasive disease caused by Helicobacter. It never causes a bacteremia, never invades the human being and causes infection in any other tissues. So I just wanted to give you an example of how this close relationship exists between some of these bacteria, the way God created us, and our own cells. They also help. Now, this is a very, very interesting thing that, there's a parasite called Toxoplasma. Toxoplasma gondii is one that makes you more a risk taker. So experiments done by this gentleman over here, Yaroslav Flieger, was he discovered that mice who are infected with Toxoplasma are less afraid of cats, and they're attracted to cat urine. So when one of my fellows, who's actually now doing her infectious disease fellowship, she was in the UAE, she did a lot of work on Toxoplasma. Did you know that if you're infected with Toxoplasma, you are also more of a risk taker? And people who are toxo antibody positive are more likely to be rash drivers and get into accidents than those who are toxo negative. So these things have an intricate relationship. I'm just trying to emphasize the fact that the biological world that God created has an interdependency that is so complicated that it is very difficult to fathom. So are this use of antibiotics disturbing our internal equilibrium with these bacteria that reside within us? And so Professor Martin Blaser has this book. I would encourage anybody who has time to read this book. It's a very interesting layperson's book that came out. It's called The Missing Microbes. By missing microbes, he means that we have consumed antibiotics to the point now that the human structure, our anatomy, has been altered already. If you compare human beings from today with human beings 200 years ago, we have less than 50% biodiversity in our gut than existed 150, 200 years ago. So we are losing all of these essential bacteria that were good for us. And now these are not being transmitted from mother to children. So we're permanently losing these bacteria. And here is proof of that. This is a longitudinal study here in the United States. Has been going on for many, many years. You can see that people born in 1915 down to 1995, these are slightly older data, but this was published in Nature. And this shows the loss of Helicobacter, which is an essential commensal bacterium from the stomach, from early 20th century all the way down to the late 20th century. So these are men and women who have actually, this is the prevalence of these bacteria within their stomach, which was 60 to 80. And even today, for example, in Pakistan, you'll find that human beings have Helicobacter in their stomachs in far greater proportion to the United States, where they've been eliminated. So you can see that we're losing Helicobacter. And what are the consequences of this? So Professor Blaser, he has postulated, and there's a lot of evidence to this, that this loss of Helicobacter is resulting in an epidemic of other diseases, including asthma, diabetes, hay fever, obesity, inflammatory bowel disease, connective tissue disease. And we're only beginning to see there's been a 500% rise in the incidence of asthma over the past 3 to 4 decades. Similarly is the story with things like Crohn's disease. When we were kids, we went to school, we hardly saw any children with nut allergy, almond or cashew nut or etc. Now, if you go to school, in primary school, you'll find many, many children with nut allergies. So again, I'm going to skip this slide, but to show you that if you take antibiotics, you'll be fatter and more obese. And this is data that the animal husbandry industry has known for many, many years. They have known for a long time that if you feed cows, chickens, goats antibiotics, you will get fatter cows, fatter chicken, and fatter goats. So what they do is that they mix. So this is data published in the New England Journal of Medicine. There was an editorial that said that in 2009, 3 million kilograms of antibiotics were administered to human patients. But at the same time, the next year in 2010, 13 million kilograms were given to animals. Now, the reason to give these is purely in feed. And you can see the earlier, these blue bars over here talk about feed efficiency and growth rate. So the earlier, which is the starter group, which is antibiotics given to very young calves, if you start with the adolescent age in these animals and in the later phase. So if you look at the blue bar where they give antibiotics right from young age as the animal is born, you can see it has the greatest impact. Feed efficiency means that these animals tend to extract more calories from food right up front, and their growth rate is much faster than the other animals. So this is the reason why antibiotics are used. Now, there's a lot of data to suggest that over the past 4 decades, human beings have grown obese, not because of overeating, because over the last 20 years, if you look at food data in the United States, people have been consuming healthier and healthier food, but they are getting more and more obese. The McDonald's epidemic, or the epidemic of fast food, actually was before the 1990s. Since then, actually, the average consumption in many states of fast food is going down. Yet, look at the numbers. When I first came to the US in 1990, obesity existed in only 14% of the population. By 2009, you had more than 30% of the population in the severely obese range. And in 2020, these are data that I just pulled from the internet, you can see that the ratio has even increased and more states have now severe obesity, despite many, many campaigns about healthy eating and all of that. And if you actually look at the data from people like Martin Blaser, it shows that perhaps the consumption of antibiotics is actually one of the factors contributing to this obesity epidemic. So one thing I wanted to emphasize again is that some of these disturbances when you take antibiotics last for a very, very long time. So you should be very careful before you decide to just, and this is less prevalent now in the US, where there is more judicious use of antibiotics. But if you go to countries like Pakistan, or maybe even Egypt, or many other third world countries where antibiotics are not regulated, antibiotics are given to children like candy. Almost every ear infection, every throat infection, every little episode of diarrhea is given, antibiotics are given to. And all of these, we know now that these can be easily treated without the consumption of antibiotics. But still, unfortunately, this message. So there have been experiments conducted, particularly in animals, to show that even a short course of antibiotics, as short as 5 days, can result in a 10-month disturbance in your intestinal healthy microbiota. These are again, the healthy bacteria that help you regulate a healthy life. So even taking antibiotics for 5 or 7 days can disrupt these for sometimes months to years. So this is really sobering information. And, I think you all know, I don't know if you know the development of very resistant infections, something that is called Clostridium difficile. And sometimes it is so severe that the only treatment is transplantation of gut bacteria from a relative back into your stomach. There's a very interesting story. I don't know how much time do we have, Najib? I don't want to.
No, you can go ahead. We have enough time.
Okay, so there's a very interesting story that was published in Lancet about a woman whose daughter developed, a woman who developed this severe gut infection called Clostridium difficile colitis after consumption of antibiotics. It's an inflammatory condition of the gut which can kill you. And she went through all the treatments with antibiotics, and nothing was able to heal her. So finally, she was given a transplant of what we call fecal microbiota. Basically, gut bacteria from her daughter were transplanted into her gut in order to recover. And she recovered, obviously, with this treatment, which has a 100% success rate. So after she received the gut bacteria from her daughter, she acquired the phenotype of her daughter. Now, she was a lean woman all her life. Her BMI was 22. Her daughter's BMI was 45. Within 6 months of the gut transplant, her BMI went up to 40. And without any clear change in her dietary habits. So this was published in Lancet a few years ago. It was a very interesting study to that. Now, the last, I just have 2 or 3 slides, and this is what you all know about, and this is why I didn't lecture about it initially. We all know that antibiotics are losing their efficacy. In fact, it is such a prominent problem that this is the statement by Margaret Chan, who was the Director General of the WHO in that time in 2012. Now she's gone, but she at that time said that bacteria are starting to become so resistant to common antibiotics that it could bring about the end of modern medicine as we know it. And she postulated that we would be entering a post-antibiotic era, in which we would not be able to perform all the modern things we do, like chemotherapy and surgery and all of that, because all of these things depend on our ability to prescribe antibiotics. That now in Greece, for example, in 2016 or 17, I forget, they had to actually cancel all orthopedic surgeries throughout the country for many, many months because they faced an epidemic of a bacterium that was infecting the prosthetic joints that they had no treatment for, absolutely none. So this is a very real problem and has been discussed in all the important, when something is discussed by these countries in the G7 or the G20, you know that this is very, very important. Well, out of all the medical issues in the world, the only one that has been discussed at the G7 level has been antimicrobial resistance. And it has been ranked by the World Economic Forum as the number 4 threat to humanity in wiping human beings out of the planet. So these were kind of postures from those meetings. So anyway, I think I have probably touched on the main points that I wanted to touch on. And this last slide it goes back to the point that I was making. The absence of evidence is not the evidence of absence. These are ads that you can find today. You can just Google these. These are from medical journals. One of them is from the New England Journal of Medicine, the most prestigious medical journal in the world, where doctors at one point in time were advocating cigarettes and cigarette smoking in ads in these journals, which is unthinkable now just because there was no evidence that smoking is bad for your health. Although, you know, it was probably something that was very commonsensical. My grandmother would have told you, she didn't go to school for a day, that, you know, if you have a cigarette in your mouth and you're smoking and inhaling smoke into your lungs, it can't be good for you. So sometimes we wait for the evidence. I'm not saying that you shouldn't. Scientific evidence is the base of our modern developments and our progress. But sometimes I think we are arrogant and we stretch our achievements too far, and take too much credit for what we do. So with that, I'll pause and I'll just leave the floor open to questions.
Rayhan, you did an excellent job. I have something to add if that's okay with you.
Oh, absolutely. It's open forum. Inshallah,
Okay.
anybody who wants to add, and if I have some answers that I can give, I'd be more than.
Okay. So you touch in detail about microbiome, the
Yes.
commensal microbiome. That's
Correct.
the biggest topic nowadays going on in the last 10 years, to my
Correct.
knowledge. Actually, in psychiatry, we are looking into that.
Yes,
And
yes.
so let me tell you something which I know, and you know much better than it. So human genome have 30,000 in it. You know, when they looked into it, they found out 30,000. But when they look into the bacteria, we have more than 100 trillion bacteria in the body.
Yes.
And when they look at the genome, they find 100,000 genomes in the bacteria.
Yeah,
So we were hitting the human genes, but killing the bacteria, which is 100,000 genes. And that was the huge issue came up, that you have a good bug and bad bug is the concept. You were killing the bugs. And actually, why it's so important in psychiatry, I will explain to you. Because what we do is when we give antibiotics, we kill so much bacteria that we lose the balance, which called dysbiosis. You know, that's the terminology used. So we kill so much bacteria. Unfortunately, the serotonin, 80% of the serotonin is produced in the GI tract. Now, this is where the psychiatry comes into the problem. Like, you know, people with depression, anxiety, and all those things, you're giving medication to increase serotonin, but these antibiotics, you're killing the serotonin. 80% are destroyed here. And that is the biggest issue came up in the last 10 years, that even if you're giving medicine for depression with antibiotics, what you're doing to your body, because these bacteria are producing serotonin. And basically what your gut endocrine system gets so much disturbed that neuropeptides and neurotransmitters which are released from that, they affects your serotonin level. So in fact, in Alzheimer's disease, they are looking into it. They are looking at anxiety, depression on that. So this is a huge topic in psychiatry in the last 10 years. And now they are actually, it's called psychobiotics now has come up. And we are coming up with some medication for that. So how to overcome, and in the last 10 years, this human genome system has been come up, that how can we work on that issue, so help the psychiatry portion, because we take antibiotics like a pill, not realizing the long-term consequences. And by the way, as the infection has gone down a little bit, the neuroinflammation and the autoimmune disease has gone up the hill, because we are killing the bacteria. They are the one protecting it. So that's why we have so much diseases coming up otherwise, because we are killing the bacteria. So you hit really well. I think so. You made really great points. And I think so we should be careful prescribing medication. Yeah, there's a lot of consequences. You know, you have to take care of the patients and all those things. Risk-benefit ratios and all those things, but be careful not just prescribing medication.
Because
Neil,
one thing I'd like to add is that one thing I didn't mention was this concept of holistic approach to medicine. The empiricist philosophy is that you can break down something into its constitutional elements. So if I want to understand, let's say, a train, if I break the train down into its components, I'll be able to understand it. That's called empiricism. One of the problems with empiricism is that it misses out on the holistic approach because we are an integrated system. So it's not what you eat, it's how you eat, with whom you eat, whether you're eating sitting down or standing up, whether you're eating with your friends or your family. These things are what we know traditionally have been very important in Islam. Religion teaches us that there is certain etiquettes. Meal is not just calories getting into your body. It's not just carbohydrates, proteins, and fats. It is an ethic. It is part of worship, the way you respect food, not wasting it, eating properly, not filling your stomach, leaving, a third for water, a third for air. These are, within the prophetic tradition, things that we should abide by because they have consequences that we're only now learning to, we're now beginning to understand. So I do believe that, for example, there's a whole literature about food that grows out of the ground where you live is much more beneficial to you than importing. Today, if I want to eat grapes, I will order them from Brazil, no matter what time of the year it is. I mean, really, could that be that simple? Even if you look at animals, they do not eat non-seasonal fruit. They're genetically programmed not to eat fruit that's non-seasonal. And often, many animals will avoid that. So there are other aspects. I'm not saying that I know the answer, but I'm saying that you should be aware that there are other dimensions of science. I often kid with my neurologists, I say that your explanation of the brain is simpler than the artificial intelligence system in my car. That's how dumbed down you make it seem. So, I mean, I cannot believe that something that is so intricately created by God would be so simple as to rely only on, one end, we have dopamine. I mean, come on. Your dopamine or your epinephrine or serotonin cannot explain to me the complexities of human nature. Any other questions?
Rayhan, really very nice and informative lecture. I just wanted to ask you one thing. You brought the point of H. pylori infection, yes. And these days people are, the gastroenterologists, they do EGDs and they find H. pylori as just because they do a biopsy that comes back positive, and then they advocate that it should be treated. So what is your opinion on that?
So there are certainly, I firmly believe there are cases where you do need to treat H. pylori. There are people with Helicobacter-related peptic ulcer disease. But if you look at it from a historic point of view, even peptic ulcer disease is a new phenomenon. People now have gastritis and gastric ulcer disease, peptic ulcer disease at a very, very high rate when compared with data from 100 years ago or 200 years ago. It is a modern phenomenon. We are doing something with our diet and the way we live that is causing an dysbiosis, as Najib described, to the H. pylori that were beneficial for us. So initially, now what we're doing is we're perturbing these bacteria into becoming dysbiotic and causing disease. So this is a lifestyle. Most cases of dyspepsia are lifestyle related. There are very few, yes, where you do need to intervene. And I think if you look at the guidelines, even from the American Society of Gastroenterology, they will tell you that a lot of the intervention that needs to be done is to tell the patient how to eat, how to live, how to not overeat, how to eat early during the, before it gets too late, or not to erratically eat, not to eat fast food. So a lot of these things that are the cause for that dyspepsia are being blamed on Helicobacter, and we're eradicating the Helicobacter, but not changing the behavioral pattern. And this is prevalent in modern medicine because now we think that the pill will solve everything. So we don't tell our patients, we don't counsel our patients about healthy lifestyles because, hey, what's the use about telling people to eat healthy? Here, take the metformin or take whatever you need for your diabetes. This has become a very prevalent theme in modern medicine.
So, but are you telling me that if a person does not have dyspepsia, does not have peptic ulcer,
he doesn't need any treatment for
and on EGD, he was positive for H. pylori, he should not be treated?
He should never be treated. Helicobacter is a commensal. It is an essential organism for the health of human beings. It is transmitted from your mother to you. You only acquire Helicobacter through maternal flora. When you are a child, and if your mother had Helicobacter, you inherit that specific strain of Helicobacter. bacteria, just like human beings, they have their own characteristic traits. So your Helicobacter is different from mine, is different from anybody else. My Helicobacter matches my family, my mother, my brothers, my siblings. So when we eat food together, we share our commensal flora. In the old days, mothers pre-masticated their food. They chewed it in their mouths and gave it to their children. This is a very, very beneficial activity that should be encouraged to be done from an infectious disease standpoint. I always tell my patients, that's the way you should feed your children. Don't buy, products off the market. The best way to do is to let mom, breastfeed and pre-masticate the food for the child who can't chew yet. And this is the way to do it, because you share these genetic elements that reside within bacteria. So yes, old autopsy studies from the 19th century clearly show that the majority of the human population, and for that matter, all mammals, whether they are elephants, giraffes, rats, mice, they all have Helicobacter in their stomachs. And it's therefore, we believe that God may have created us that way. And even if you're an evolutionary biologist, you might pause and think, hey, how come all mammals have this bacteria in their stomach? There must be some evolutionary reason for it. It's probably because they are part of the commensal flora and beneficial for us.
So, gastroenterologists, they advocate that if you don't take it, you have a risk of getting peptic ulcer disease. That's why.
No, actually, this is wrong. This is not the recommendation of the American Society of Gastroenterology. If you look at the ASG guidelines, they do not recommend eradication of Helicobacter if you find it in a biopsy. It's only if the patient has symptoms that amount to peptic ulcer disease or an equivalent. But merely finding the bacterium is not reason for treating it.
Okay, all right. Well, I'm a pulmonologist, but I'm
okay. Well, there is a pulmonary flora as well that's commensal. So,
right. This is my personal experience. I'm just, this is something that's happened to me.
Yes, you're absolutely right. Physicians actually don't follow the guidelines always. The practice of medicine is highly driven by economic and market concerns as well, in addition to medical concerns. So I think there's a lot that we do. One of the biggest abusers of antibiotics are infectious disease physicians. The data shows that ID physicians prescribe more antibiotics than non-ID physicians, irresponsibly, not according to judicious use.
The other question I had was, these days, we as pulmonologists in extreme cases sometimes use Zithromax as an anti-inflammatory drug in people who just don't get better as far as their exacerbation is concerned, their bronchospasm is concerned. What is your opinion on that? Is that the benefits outweigh the risks, or?
Yes, I do believe so. And I have also prescribed azithromycin in those circumstances where you have chronic inflammatory lung conditions, where you can give cycles of drugs like azithromycin to modulate the inflammatory response. In that particular case, I think the benefits outweigh the harm. And it's a judgment call, but yes, I think in that situation, there is clearly benefit to use certain drugs. There were case studies in sepsis. And I think there was one study using clarithromycin in sepsis that was a failed study. It was a negative outcome, but these antibiotics have been used as modulators of sepsis as well.
Okay. All right. Thanks very much.
You're welcome.
Hello, everybody. This is Arif.
Assalamu alaikum.
Walaikum assalam, Rayhan. I had one question. We know that studies have shown that if you're raised in farms, then you get exposed to all kinds of bacteria, and it makes you immune to so many other diseases in future. So short of that, now that we are living in a different kind of environment, what we can do to improve our microbiome given that limitation?
I think that one of the ways I always tell patients is try to cook and eat at home using fresh produce and home-cooked food. This will encourage the family to eat together on one table. I believe that communal eating with your family is very important. I think this is very Islamic. This is something that we should all encourage. Never eat on the go. Food should be taken as something that is a blessing from Allah subhanahu wa ta'ala. You do not disregarded by just, grabbing a sandwich and eating on, quote unquote, on the go. I think, there are certain etiquettes that go along with it. So home cooked food, fresh produce that comes from the market has sufficient microbiota within it. You cook it at home, you share your meal with your family members. Now, you can have a whole debate on whether, you should be eating in a common utensil or, separate it out. I'm not going to go into that discussion, but certainly there are known benefits to sharing food within a family and completing that food and not letting it go to waste. And data is coming out on those kind of things. So that's what I would encourage. Try to avoid eating preserved food that is kept on the shelf for months on end. Try to eat fresh, things of that sort. I don't know if, you'll find on the shelf here, I think I have a picture of that. You'll find what they call healthy bacteria. So nowadays, if you go to the supermarket, you see these probiotic foods, and the jury is still out. I don't think you can actually take a concoction of bacteria and just ingest it. The complexity of your microbiome is far greater than just ingesting a bunch of probiotics. It might help you alleviate some diarrhea when you're taking antibiotics, but nothing beyond that.
Oh, thank you.
Hello,
Rayhan, I have-
Assalamualaikum, Rayhan.
Alaikum salam.
This is Mujib. How are you?
Oh, Mujib.
Yeah,
There's
it
the
was a
twin.
good lecture. Yeah, that's right.
Since
Well,
Brother Raid was asking us, so there's the twin.
Yep, here I am. It was a good lecture, by the way.
Oh, yeah.
Well, I have a quick question, actually, a couple of questions. Have there been any bacteria which have been associated with obesity? Have they been
Oh, yes.
identified?
So I
And what's
skipped-
the role of, and the other question I have is, what's the role of yogurt? We have been told that eat yogurt and that may actually help with obesity. Does that have any health role in the diet, eating yogurt? So these are the two questions.
So the first part of your question is this slide over here that I quickly went to. I skipped, but this is the stomach that has Helicobacter in it. This is the ancient stomach, and this is the modern stomach where you've treated and gotten rid of the Helicobacter. The two main hormones are leptin and ghrelin that are the appetite hormones. So leptin actually goes down, and this is your appetite suppressant hormone. Ghrelin goes up, which is your appetite stimulatory hormone. So people without Helicobacter actually feel more hungry and they eat more than people without. So this is the reason why obesity, and there are extensive studies on this. Now, this is beyond just association. There is proof that obesity, and like I said, this proof existed in animals from the 1960s. I mean, we've known that feeding animals, one of the papers that I didn't mention over here, this was published in Nature, and this is where mice were given intermittent antibiotic therapy since childhood. And you can see these are the outcomes of the mice. The mouse on the right is a normal fed mouse, and the mouse on the left is the one that had antibiotics given in low doses intermittently since birth. And you can see the difference. So there's fat accumulation in the visceral tissues and obesity that results from antibiotic exposure at very low levels even.
But no particular bacteria has been identified as causing obesity or preventing obesity?
Helicobacter is perhaps the main one. There may be others, but Helicobacter is the main one that regulates your appetite.
Okay.
Now, as regards yogurt, I'm not sure. I mean, I don't think I have enough information regarding probiotic yogurt, but my feeling again is that we're trying to simplify the concept too far. I think what happens is that the concoction of antibiotics in these probiotics like lactobacillus or streptomyces are just too simple to replace the kind of complexity that results in the microbiome for your gut. So like I said, the microbiome, those bacteria that reside in your gut are specific to you and your family. They're inherited from your mother, more or less. So they're genetic elements. And like Najib was saying, they are a large contributor of who we are as human beings.
Okay, great. Thank you very much.
Thank you, Brother Rayhan. Amani has a question. Sister Amani.
Certainly. Yes, Sister Amani.
Yeah, great lecture, and this is not fair. I should have asked first because I'm gonna use no medical terms. I feel smarter already just listening to this lecture. So with my question is, so as a mother, like you take your kid to the physician, I trust that doctor for giving my child the adequate and appropriate and the most efficient medicine, and most likely it's always antibiotics. Should I just wait until my kid gets better and ignore the fact that I have a prescription? Or like after listening to this lecture now, like I just wonder, what should I do?
No, by all means, I am not advocating not listening to your physician. And physicians are also like us. I mean, the most important questions are asked by the outsider from. So your question is very, very pertinent, because if you're not a physician, then your question is always going to be very incisive. I believe that. So this is, I think, the most important question. So going to the physician and listening to the advice, by all means, is what you should do. Physicians themselves, as we're learning, you will find more and more physicians nowadays more reluctant to prescribe drugs unnecessarily. And there has been a lot of change in the practice of physicians as well. And to be fair, I mean, this is what we know now, but human knowledge continues to grow. So the recommendation may change with time again. And so I think the best thing to do is to use the knowledge that Allah subhanahu wa ta'ala has given us at that moment in time. But the point that I was trying to make was that sometimes we put too much stock in our own knowledge and extrapolate the gains for our own satisfaction that we've done something that is. But as far as your question is concerned, no. I mean, I think I would be wrong to second guess the intent and the knowledge of the physician who's just examined your child and has prescribed antibiotics. I would never advocate you not to take that according to the prescription. Please go ahead and do that. And the rates of prescription of antibiotics in the United States are far lower than those in countries where physicians are not responsible for prescribing antibiotics. I have actually somewhere around here, I wanted to show you the graph and you'll be surprised. I think I probably don't have it. Here you go. These are the highest rates of antibiotic prescriptions amongst children. And as you can see, none of these cities are where people take their children to physicians. So actually going to the physician decreases the risk in these countries where people are just taking antibiotics from each other, or just because my one child was prescribed antibiotic, I'm going to feed it to the second child. So you can see this is Nashero Feroz is actually the highest rate of antibiotic prescription is in Pakistan. This is a village in Pakistan where they found that by the age of, even before the age of 1, the child had already taken more than 12 rounds of antibiotics.
Thank you.
Brother Rayhan, I have one quick question. So now when we go to grocery stores and other places, we have genetic engineering for GMOs. What are your recommendations, as I try to avoid it, but you tell from your end?
I don't know, Najib. I don't think I'm sufficiently knowledgeable to answer that question. I mean, I try to avoid things, but I think that's more just my gut than any information that I have. I don't think there are any long-term studies that actually show yet that these kind of alterations may have. I think from a holistic point of view, there may be certain negative consequences, but I'm not sure.
So it does not affect the bacteria, or it does affect the bacteria?
Again, I don't think there's any data on that yet.
Okay.
So I can't comment on it.
There's a lot of data coming for autistic childs, and we recommend not to take GMOs for people who have autism, or risk goes up. So, but we are working on it. Like data needs to be collected.
Yes, I think that's a very interesting. That's a very interesting area of medicine. The gut microbiome, and they call it the gut neural axis.
Yeah, it's actually the brain-gut axis,
correct.
and it has a huge consequences. There's actually a huge study as dyslexia. Actually, people with autism have GI problems, and that's what they have found, that microbiome is the biggest issue. And this in autism, that's the biggest issue, because they go to the doctors and the doctors keep on prescribing, but actually they are hurting in that way who have autism disorder, because it's very common to have constipation, diarrhea, and all those things, because they have pretty much destroyed the healthy bacteria over there.
So it is interesting. There's one additional comment that I thought was intriguing, that, you know, we know from even the Quran that, you know, when there is certain communication that occurs in living things. Animals have speech. They can communicate with each other. So it is interesting that bacteria actually can speak to each other as well. And
correct, and they have a sleep cycle too.
They have a sleep cycle as well. And so
that was surprising.
There are experiments done that if you perturb the bacteria in your mouth, let's say on the second molar tooth on the right, there are subtle changes that occur in the same locale on the left side of the mouth. So there is pairing. So these bacteria are distributed evenly, just like your ears, your nostrils, your organs, you know, they have certain symmetry. So the perturbance of a certain locale on one side of the body, the bacteria communicate with each other.
We have galaxies of bacteria in ourselves. We never looked into it.
Correct. Absolutely.
Wonderful presentation, Brother Rayhan. The one thing that you brought up about allergies and, like, for example, the not allergies, and now, you know, schools even have not free classrooms, the cafeterias and things like that. So you think this is related to the disturbance of the microbiome and how we're dealing with bacteria, in the sense that we're dealing with bacteria as an enemy versus something that we've lived for, you know, thousands of years or hundreds of thousands of years, or, you know, since the beginning of creation, or millions of years until now?
So that is certainly the postulated theory. I think that the evidence is still being gathered on that. It is, I think, part of the reason of these nut allergies, at least people like I cited Martin Blazer, whose main research focus is Helicobacter, which is this bacterium that resides in the stomach. He has written extensively, and by the way, he's a gastroenterologist and an ID physician. He has interests with Helicobacter, but he suggests that there is a relationship between the use of antibiotics and the increase in all allergic disorders, asthma and nut allergy being the two main areas where humans have felt impact. So both of these diseases have increased more than 5 to 10-fold in certain areas of the world. I mean, like, and I'm sure that you remember your childhood years where nut allergies were very, very rare, and now children have them. So probably multifactorial, but one of the factors appears to be the change in our microbiome related to consumption of antibiotics. But I don't think there's been like long-term confirmed studies that are prospective, looking at groups, one taking antibiotics and the other not. These are more studies based on association rather than prospective proof.
Great. It's honestly, if we look at cases like in different fields, I think we sometimes try to solve one problem and then we create 10 others, right? You know.
Correct. Yes. This is true, and that is okay. I mean, I guess my point again was that sometimes our claims are very grandiose. There's hubris in statements that we make, and all of a sudden we discover one thing and we say, hey, we've, you know, suddenly eggs are good for you or they're bad for you. And then, everybody's on a bandwagon having, X, Y, or Z just because somebody discovered a very minor thing. So I think our society is plagued with fads. Everybody is on a bandwagon. Giving up commonsensical living principles based on, just one discovery. And you take your entire lifestyle and throw it in the trash just because somebody told you that having vitamin E is good for you, and then all of a sudden you're so you know what I mean. That's the kind of fad that we live in these days. And WhatsApp and Facebook and these kind of social media platforms are highly detrimental in disseminating incorrect. I think for every truth that is disseminated, there are 10 lies that get across.
Definitely, yes. And it's scary because there are a lot of people who come in the garb of being experts or advisors, and then they mess up a lot of things for others, right?
Absolutely, yeah. Everybody is a self-proclaimed expert of any topic.
Mm-hmm. Yes. Yeah, your beginning of the presentation, brought me to look on Allah subhanahu wa ta'ala in the Quran, Surah An-Nisa 119. So all try to look it up. But the ayah talks about that they wanted to change the creation of Allah subhanahu wa ta'ala, the shaitan, and how the shaitan misleads and gives fake promises to people. And this is what you alluded to. And it's interesting, we are now doing the tafsir class and we are studying Surah Al-Mulk. I'll send you, Rayhan, the link to it. And Najib, if you can share also with the Ganwala brothers as well. The first 4 ayat gives the answer to all of this, so it's good to see 119 of Surah An-Nisa, and go to Surah Al-Mulk, and this is the response of those who can claim that things will happen where they want and they're in control and in charge.
I mean, we already believe, as it is in Surah Teen, لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ. We're already the best constitution that we can be. So altering it is not like an evolutionary thing that we're going to get better, as was postulated by, Homo Deus or these kind of modern things. I mean, from an Islamic point of view, I believe that we already believe that the constitution that God created us with is the supreme form of it.
Alhamdulillah. Alhamdulillah. And your presentation looked, when I look at ayah number 3 in Surah Al-Mulk, like how Allah subhanahu wa ta'ala made the universe in perfection, that things fit in a way that, it's related to the majesty of Allah subhanahu wa ta'ala and the perfection of Allah subhanahu wa ta'ala. So, your presentation showed if you change something, there are a lot of consequences to it. It's not, as simple as we think things are, right? So this is amazing. Yeah, thank you. Sister Amani, your hand is up. Did you want to say anything, or do you have any questions, or you just left it? Okay, I think you just left it. Does anybody have any comments or questions to Brother Rayhan?
Well, Jazakallah khair for the opportunity. I think we're over the I usually myself drop off at about 9:15, so I would be rude if I tell people to hang on. I think it's 9:30 already.
Excellent presentation, Rayhan. It was really nice.
Jazakallah khair.
Jazakallah khair. We'll make a dua and then we will adjourn, inshallah. Next week, we will meet at the same time. And inshallah, my daughters will present to us what the kids want from their parents in Ramadan.
MashaAllah, that's a great topic, inshallah.
Inshallah. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك سبحانك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وصلى الله وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. Thank you so much and inshallah we'll see you next week. Ramadan Mubarak to all.
Ramzan Mubarak. Thank you very much, everybody, joining.
Ramzan Mubarak. Thanks very much, everybody.
Thank you. Assalamu alaikum.
Wa alaikum salam.
Wa alaikum salam.